Here we go. And as soon as I hit start. Hello and welcome to Western Wednesday at the College of Health and Human Services here in Kalamazoo, Michigan. Thanks for calling in today. It is a great day to be thinking about being a Bronco. My name is Lisa Brennan. I am the director of the Western Regional Area Health Education Center for the College of Health and Human Services. And we are going to spend approximately the next 45 minutes together getting to know the programs and the services that our college has to offer. I'd like to remind you that this is an interactive session. So if you, on the device that you're using, if you click on that screen and locate the speech bubble icon and click on that, this is where you will write your questions and comments for me. And then if you could, if you're comfortable, go down to that drop-down box and click all panelists and attendees. That will allow all of the attendees to see your questions. I will try and remember to repeat the question so that you know what I'm answering. So if you're comfortable there, please feel free to do that. And to get started today, if you would, I'd love to give a shout out and see where we're calling in from today. If you'd go to that dialog box and type in the city and state that you're calling in from, and perhaps here also type in the academic program that you're considering studying at our college so that we can try to focus on the programs that you're interested in. And remember that your questions will help to drive the discussion. So please don't be shy. We're here to learn, and it's important in the learning process to answer questions. So I'll give you a few seconds to type in where you're from and the program that you're considering. And then I'm going to open up our college webpage. So a couple seconds here to get that up and running. Okay, I see some comments coming in. Ohio, awesome. Awesome. Ohio, yes, yes. Ann Arbor, Michigan, very good. Physician assistants. All right. Who else is out there today? Okay, well, let me talk a little bit more about our college, just some background information. And if you haven't explored, and I'm sure that you probably have, Rochester Hills and nursing, okay, very good, thanks. Our website is www.wmich.edu/HHS, and that's Health and Human Services. Get familiar with the website. We have just a lot of information on there that can be very helpful if we don't get to it today. A couple things about our college. We have been educating students in allied health and human service professions for about 42 years. We have a lot of experience in the education of health profession programs. Employers seek our graduates. They come highly recommended in clinical trainings and our programs. 4 of our programs are ranked in the top 50 by the U.S. News and World Report. We'll go over some of that. We currently have about 2,050 undergraduate students in our college, 860 graduate and certificate program students in the college, and then about 65 doctoral students in our PhD program, with over 18,000 alumni across the country. So just some background information there. Let's go to, let's see, we're looking at nursing. Let's check out our nursing program first. And please feel free, remember, to drop your questions in that dialog box. Nursing is a very popular program in our college, and it's very competitive. And I tell you that not to scare you off, but so that you know coming in that it's a rigorous academic program. You will be trained very well when you graduate from the program, but there are some criteria that you will need to meet. So all of you, if you're interested in coming to Western, will apply to Western. You can declare your major, and if you declare a pre-nursing major, you need to know that you're not automatically accepted into the nursing program. And that's how it is with a lot of our health professional programs, that if you're accepted into Western, you declare that major, you will then also need to apply for the health professional program. And so nursing is exactly like that. You declare your pre-nursing major, you get accepted, and then you will take your pre-nursing curriculum, your prereqs. You'll go through all of the classes. We see two types of nursing students at Western, two typical groups. So our first group are the students who are brand new to nursing, and they're coming in to get his or her BSN. And we also see the second group is the group of students who they have their RN and they want to matriculate to their Bachelors in Science of Nursing. So they have their licensure, their ADN, their associate degree in nursing, and they want to proceed and progress into getting their BSN. So those are the two groups of students that we typically see in the nursing program. So after you go through your pre-nursing courses, you will apply for nursing school. In the latest you would apply would be your last semester, where you're finishing up your prereqs to apply. So let's see if I can pull this up here. Okay, and what they're going to be looking at in those prereqs for admissions into the Bronson School of Nursing is going to be your overall GPA and then the scores that you receive in those hard sciences. That's going to be the same with a lot of the physician assistant program when you go to apply there. We're looking at the hard science prereqs to get you in there. And you earn no less than a C to pass the course, but honestly, to get into some of these more competitive programs, you're looking at needing an A in those hard sciences to really be weighed heavily to be admitted into the nursing program. We admit students twice a year into the nursing program for fall and spring, and all of those deadlines are actually on the website. Here, you can read through those. I'd like to pick up some of the questions that you have. While we're on nursing, is there anything else nursing that you're looking for? Direct admit. So the direct admit, that's a great question. The direct admit program. So we have 10 slots for direct admit from high school. And so the application will be due the November of your senior year, November 1st. So the sooner you can get it in, the better. And they're going to be looking at, again, your overall GPA, the high school curriculum that you've taken during your 4 years, your science courses. They're looking at least a GPA of 3.6 or higher for that direct admit. And then they will look at those. The fall that you will be coming in, you will know before you come into the fall if you have one of those 10 seats for direct admit. If you don't get in as a direct admit, you can certainly still apply, do the pre-nursing major and then apply that last semester when you finish up all of the pre-nursing curriculum courses. So another question here, does anatomy and physiology count as one of the 2 biology courses? And so if that is a really good question, and let me see if I can find that on here. And I encourage you to also reach out to our academic advisors who are well-versed in the actual undergraduate, what qualifies for what. If you're looking at transferring in AP courses, or you've taken dual enrollment courses. Let's see here, program curriculum. So Bio 1910 is the introduction to human biology and anatomy. So does the anatomy physiology count as one of the 2 biology courses? I am going to say yes, that it does. But again, I would encourage you to reach out to an academic advisor, and I will leave you at the end of this at the end of this call with my direct telephone number and email, so that we can connect and I can get you right into the nursing academic advisor. One more question is, you are welcome. One more question, when is the direct admit notification to the students? So the application is due by November 1st for direct admit, and then you should hear within a few months of your result for that direct admit notification. Let's go back up to Ann Arbor, who's looking at the physician assistant program. So that's one of our graduate programs. Let me just pull this up here. And again, I'm sure that you have gone in. Do you have any specific questions about the physician assistant studies? It's another program that you will need to apply to and be accepted. We have a wonderful, highly rated physician assistant program. It's one of the top, two of the top rated programs that are 100 of its kind across the nation by U.S. World News and Report. Anything specific about physician assistant that you're thinking about? Go ahead and throw your question in there. Is it a 24-month program or a 48-month program? So it is a 2-year program and they go year-round. So I would say that it is 24 months. So 2 years, full-time, year-round for PA. Any other questions? Jacob, anything that you would like to ask about our geriatric program? And a lot of the health professional programs, remember, you could graduate with your BSN and want to work specifically with the senior population, the geriatric population. Same with physician assistant. So that's something that you can always specialize within your health professional program. So I'm going to go into here, let's segue into some of the commonly asked questions that we hear from students when they come into the programs. One of them is, what programs do we offer that are really popular? And of course, a lot of our health and human service programs are popular because of the employment opportunities that are open and available to them in the nursing, the physician assistant, occupational therapy. We just admitted our first cohort for our DPT, our physical therapy program. They're all well sought after, highly competitive programs. And the reputation for the high quality of education that we provide, not just in the didactic and the coursework, but in the clinical rotation opportunities that you will receive from our programs. One of the wonderful brown and gold little nuggets that we have within our college is the Unified Clinics, which is right on our campus of CHHS, where we have different clinics from pediatrics to geriatrics, where students have an opportunity to work with licensed healthcare providers, do rotations, get involved in research, get involved with direct patient contact while studying and being right on campus. So Unified Clinics is something that I always like to point out. If you go to our website and look at everything that the Unified Clinics has to offer, it would be a great opportunity if you're interested to reach out later to schedule a tour and come over, and we'd be happy to show you our college and take a walk over to the clinics. It really is a wonderful opportunity for our health professional students to have access to the Unified Clinics. Another question that we hear frequently from our students is about that specific application process and the criteria required. So again, each program is different, and once you are admitted to Western and declare that major, you will then, each program has a different timeline, but you'll need to apply directly for admissions to the health professional program that you're interested in pursuing. One of the questions that we have a lot is, how many times can you apply to the program? How often do you admit to the program? And so that's something that, on an individual basis, we would look at that. If you don't get in the first time, if you don't get in the fall, perhaps apply again in the spring program. Another question, and a lot of you I see coming into our programs with college credits already, with AP courses where you test out of the with the exam and you score high enough to transfer that AP credit in to your college career to start that. And it's something, again, to really talk with your advisor about. Many of them will come in as general education requirements, which is great. What it's going to mean is that you'll be able to go into your next course at the university and potentially, staying on track, graduate a little bit earlier, depending on the amount of college credits from a dual enrollment or AP courses that you have. So keep sending those questions through. If you have anything specific that you would like to have me answer. Here's a question again from Debbie. Do nursing students need to have transportation for clinicals off campus? That's a good question. And yes, I would say that although we help to arrange those clinical rotations, having your own transportation would be ideal. I don't know that it would make or break you, depending on how many students we have going to that clinical site. But we would certainly work with you to help accommodate. But key here is that we do try to set up all of those clinical rotations for you. You're not expected to find your own clinical rotations, as happens with some of the other programs outside of Western. So having your own transportation for clinicals is probably a key to success there. That's a good question. Okay, so what can you expect as part of the experience at our college? And this is where I like to point out some of the internship opportunities, externship opportunities, and capstone projects that are required of basically all of our programs in the College of Health and Human Services. So internships are wonderful way to, either paid or unpaid, to work with an employer in the field of study that you are currently in. We provide a lot of internship opportunities across the state. We've developed a large network of employers that take our students in paid and unpaid internships, which is great to build your resume and to place that information on your resume. Externship opportunities. So the difference between internship and externship. Externship is an experience at an employer that is usually tied to a course. It's not a paid experience, but again, it's building your resume as well as helping you complete one of your course requirements for the program. And then I like to add capstone projects. What's a capstone project? And some of our programs, our health professional programs, do require capstone. It's an opportunity for you to experience research. So it's a question for a project that you are interested in investigating, and running all of the research with the faculty member who is running that capstone course for you. So kind of a deeper dive into research and helping you to look at something that you're interested in. And so we offer intern, extern, and then the capstone projects in all of our programs. And again, adds to that didactic and clinical piece so that you're better prepared when you graduate to go out into the workforce. Moving on, let's see. Another question on nursing. It's always very popular. Nursing is very popular. So do BSN students need a capstone project for graduation? I do not believe that they do. I think, and let's just pull it up to make sure that I am correct at the program curriculum. I am not seeing a Capstone Project. I think that your time is spent mostly in your extern experiences or your internship opportunities, which really are your clinical rotations, along then with all of this didactic um, material, all of the didactic courses that you will take. That's a good question about the capstone. You are welcome. Are there any scholarships specific to me trying to get a health degree? So the College of Health and Human Services itself does not have a lot of specific scholarships for our students. However, our university has a number of scholarships that you could apply toward your degree in a health or human service program. And you can find all of that stuff. We had our Western Wednesday last week with admissions. And if you go to the admissions area on our website, and I'm sorry I can't speak more to the admissions, that's not my area of expertise. But if you go to the admissions area and you're looking specifically for scholarships, there is a telephone number that you can call there and get more answers on that, Jacob. But don't limit yourself to just, Western scholarships. There are agencies who are looking for applicants to apply and compete for scholarships. Go to your local business areas. Look at your organizations, the Kiwanis clubs, all of those type of service organizations, and go online and start looking for scholarships that could be applied for you. There's a lot of money out there that you can receive for applying. And if you don't apply, you don't know if you can get any money. So do a little bit of research on what's available in your area. Don't limit yourself just to Western. Okay, so keep the questions coming. I think I have hit all of those that we have up there right now. Let me go into another question that is asked, and something that I like to highlight because success is important to you as a student and to us. I mean, the staff and faculty here at Western try to foster an environment that promotes academic success, as well as social success, and balancing that academic life with your social life and having fun while you're in college, but also making sure that you're getting access to the resources that you need to be successful and to get into the programs that you want. And so we have an entire center within our college, so it's all contained right in our college. That's a learning resource center for our students, and it has materials to help you engage and understand more. We have staff that are trained in helping students be successful. You can talk with other students and network with peers, near peer mentoring. It's focused on your success. And the one thing that I will say that's really important, no matter where you go for post-secondary education, and this should always be in focus for you. It's a two-way street, that success. And so you need to ask questions. You need to develop relationships with your staff that you come in contact with, and with your faculty. The professors that are in your courses. Don't wait until you receive a low a score on an exam to ask for clarification. We encourage that. You are not considered irritating. It's not that you don't understand something. It is a sign of intelligence and will help success if you reach out and communicate with those professors directly. Get them to know your name, get them to remember who you are, and help in that success. Communication is key. So I will encourage that strongly, to develop these relationships with your faculty, with the staff in the Learning Resource Center, and with other students who are already in the programs that you're hoping to apply to and get into. So we have other services, tutoring services that are available to you that we can arrange, but we don't know if you need tutoring unless you reach out for help. We have a wonderful, beautiful anatomage table that is utilized by many of the undergrad and graduate programs, which is a large a table that's very high tech with video that shows the entire body. It's a great way to learn anatomy and to look at how the body systems function from a real health perspective, medical, nursing perspective of how things work. And we all learn differently. We're auditory learners, visual learners, tactile learners. So having all of these different resources available to you within our college contained in that Learning Resource Center is really important and beneficial for you. So let's see, when would direct admit nursing students start? So you would start the fall after your graduation from high school. So the same time that the other students start, and you would be taking the same courses. You would be, taking the same pre-nursing curriculum classes that the other students are taking. So you would get admission to Western, you would get that direct admit, and then you would start in the fall with those pre-nursing curriculum courses. So good question there. Let me just scroll up here, make sure I've hit everything that you've asked so far. Okay, so back to that Learning Resource Center, because again, it's your success is so important to us. And we want to make sure that we're doing everything possible. We also have a lot of availability to work with faculty if you're interested in research. So we have, since 2012, our college has received, our faculty has received more than $29 million in grants, a lot of that for research, and a lot of it providing opportunities to our students to be involved with faculty in research areas and working on grants to help build that portfolio of experiences for you, things that you can put on your resume as you go out to look for a job. So we are a research college. And we strongly encourage our undergraduate students, not just our graduate students, to be involved in active research with our faculty. Because there's money available to do that, we encourage you to look for those resources to help with these research projects that faculty have going within the college. Another question that we hear often is, how does the College of Health and Human Service prepare students for their careers? So I think that we do a really good job of rigorous academic didactic training, but also exposing you to real life experiences in the classroom, in our simulation labs, over in our unified clinics. So real life experiences that are controlled, that really allow for a wonderful learning opportunity. It's better to make mistakes in the simulation lab than when you're out on a clinical rotation. So if we're able to provide you with these opportunities in your clinical trainings, they're available. And I think that's one of the things that our faculty does very, very well, is to provide you with real life experiences in a training environment so that you're ready when you go out and into those clinical training opportunities. I think again that we provide you numerous opportunities to get involved in the research that's happening within our college. It's one of our areas of pride, the amount of research that happens in our bachelor's degree of public health, in our social work program, in our physician assistant program, audiology, speech pathology, occupational therapy, and of course our simulation labs, preparing you again for life in the real world and those authentic experiences. I think again that because we have a reputation of training competent healthcare professionals, again, our graduates are sought after by employers in all aspects employment opportunities. So, you're not just, if you're looking to be a physician assistant or an occupational therapist, you're not just going into hospital settings, but, you're going into academic settings. There are opportunities in K through 12 areas. There's opportunities in local public health departments. So being able to make connections within your academic program through your faculty and the staff in our college to really open up the opportunities for employment for you, and not just always pigeonhole you into the normal employment opportunities that you would be exposed to. And those are from the relationships that we've developed with our community partners to help you place you after you are graduated. Any other questions from you guys? Anything that I haven't covered that you're looking for specifically? I think there is. I'm a little biased about this. I don't know if this is appropriate or not, but I'm going to go for it anyway. I'm a public health person, and I think sometimes that in my experience working with high school students, we know about the medical profession, we know about the nursing profession, we know about occupational therapy sometimes, physical therapy. But I'd like to point out one of our new undergraduate programs that we have. Let me get back out here. Okay, how am I going to, here we go. Let me go this way. At the college is the Bachelors of Science in Public Health. So we have an undergraduate degree in public health, and we also have a master's of public health. And public health is one of those areas of study that opens up just a plethora of opportunities. So if you're not aware of, and I'm kind of curious, if you want to throw in that dialogue box, if you know what public health is and what someone with a public health degree would do with it after they graduate. It's not a clinical degree. It's not a nursing or a physician assistant that's very specific. Throw in the box there and let me know if you are aware of what a public health professional would do with a degree like that after they graduate. And then I'm just going to talk about it a little bit. So public health looks at population health statistics, population health management. We look at the health of communities all over the world. So it's a global perspective, not just a state, a local, a national perspective, but a global perspective of looking at how healthy our communities. A lot of times we're looking at the health of communities based on zip codes. And so it's an area that can open up employment opportunities all over. Local public health, government agencies, K through 12 academic partners, of course, local public health, hospitals, nursing homes. And it trains you to look at health from a real broad perspective. And our Bachelors of Science in Public Health is looking to train you so that you can set for a board certification, which is called the CHES, or the Certified Health Education Specialist, which is another certification that you can get after your bachelor's degree, which allows you to become a specialist in health education. So, there are different areas of public health that you can go into: epidemiology and the surveillance of disease and outbreaks of smallpox, outbreaks of anthrax, and then also looking at psychosocial sciences or the health education side of it, looking at behavior change and how do you work with policy systems and environments to change health behaviors in a large group setting to impact the health of large groups of people. So it's an interesting area of study, and I encourage you to explore in our undergraduate degree that Bachelors of Public Health, and then of course, you know, the Masters of Public Health degree that we have up and running now. And you don't have to have a Bachelor's of Science in Public Health to apply for a Master's of Public Health. It can be done with one of the other undergraduate programs. So keep that in mind also. So another question here from Debbie. Do students in the programs room in certain areas of the dorm or campus? Administration of public health programs. Okay, so let me take that first one. That's a really good question, and that is something that I am not sure about. If our we don't have one dorm where all of our health and human service students necessarily stay. That would be a great question for our housing. Let me see if I can work through. That's a question, though, Debbie, that I will follow up with you on about the dorms and campus. I would, it leads me into this comment that I would encourage you, if you're able to stay on campus. You know, living on campus versus off campus and commuting in opens up so many more connections and opportunities for students when they're on campus, and they can easily get involved in projects and programs. It's a way to really build family, I think. There you go. Let's see if I can do this. Thanks, Jacob. That was pretty good. All right. And you, let me look back up here. Okay. So thank you for finding that. It's hard to be techie and to pull all of this stuff up. I appreciate that. So health professional communities. So there are areas where you can live in a dorm with other health professional students. I don't know that it's required, but Debbie, it is an option for you. So right there you have other students who are studying the same programs, easy to form study groups. And living in one of these learning communities is just a way to connect with people who are academically looking to achieve the same goals and outcomes that you're looking at. Okay, all right. So again, thanks, Jacob. So Jacob pulled up the housing for me. I like that. I took the initiative there to do that. So again, that's the health professional community. So if you go to the link, it would be www.wmich.edu/housing/health community. It is going to give you, Debbie, more in-depth answers on certain areas of the dorms and on campus that you can stay in. Good questions. Let's see. Yes. And you can see that, Jacob, that Debbie is also thanking you on that. Thanks. Very good. All right. Other questions? We are getting toward the end of our time frame here. So last opportunity to get your questions out and get them answered. Again, I will give you right now so that I don't forget my direct office number and email address. Can I type in them? Okay. So let me type this in here for you. So as I said, my name is Lisa Brennan, and I'm with the College of Health and Human Services. My telephone number is 616-771-9497, and my email address. And I encourage you to please reach out directly to me. You can, find all of this stuff on the website also, and there are telephone numbers attached to every question that you could have on our website. But sometimes it's nice to connect with someone who is going to get you right to the person that you need to get to, and to talk to someone that you've already met. So this is our first relationship that we're forming, and I encourage you to get a hold of us and schedule a tour of our campus. of the college. Take a look at our unified clinic, check out the anatomage table. We have regularly scheduled campus tours, but we're also always willing and available to take you on a private tour of our college. Bring your parents in. If there's a couple of you from the same high school that's interested in the college, come over. We can make a special arrangement for that, and I do encourage it. All right, so let's see. We are coming next Friday for the event. Excellent. Will we be able to tour the CHHS and nursing school then also? Debbie, reach out to me, email, and give me this information, and I'll make sure that we get you in there. Sometimes the nursing sim labs aren't active at the time of our tour. We don't have faculty up there and classes going on, but I would like to see if there's something that we could arrange for you. If that's something that you're interested in, we can try to accommodate that when you're coming over. And let's see, where are you coming from? So Rochester Hills. So it's a drive over for you. So we want to make sure that we're hitting everything, Debbie, that that we can for you while you're here. So if you have other questions, if you want to see something else on campus that you've heard about, send that to me in an email, and we'll make sure that we try to accommodate that for you and your parents. Yeah, you need to spend the night. So if you're looking for hotel recommendations, we also have that on our website. But I'm happy to give you all of that information too if you haven't already made a reservation on where you're going to stay, so that you're close to campus, so that it's a quick drive over in the morning when you come in for your orientation. So any possibility to stay anywhere on campus? I don't know about that. I don't think that we do that. We have all of our students back right now. Fall semester has started, but that's a good question. And actually, I don't think we have anything available, but that might be something nice to offer for future people coming in from out of town, if that's something that we could make available. I don't know. That's something for me to check out. But again, email me if you don't have a hotel reservation yet, and I can make some recommendations for places close to campus. All right, you have my direct office number. You have my direct email. I've pitched the Bachelors of Public Health, which again is one of my passions. And it is almost time to end. Anything else? I thank you again for calling in and spending some time with us. And again, I encourage you to schedule some tours and come in and see what we're all about. All right, so we're going to end here, and I look forward to seeing some of you on campus. Take good care. Thanks much. Go Broncos.